I am very excited for you all to meet today's guest. Dr. Stephanie Grice is a very popular pediatrician here in Charlottesville, Virginia. She and I connected for coffee last fall, and I was very excited to meet her because I have heard great things from my clients. I really enjoyed chatting with her about the newborn months, and I was particularly drawn to what she had to say about breastfeeding and just general feeding support. I was thrilled when she agreed to join me today to chat a little bit about feeding journeys and how no two journeys are the same. Dr. Grice practices at Piedmont Pediatrics. She's also a mom. She has a son and a stepdaughter. I'll let her fill you in a bit more when we get started. But before I dive in, I just want to note that everything that Dr. Grice shares today is intended to be educational and should not be considered medical advice. Hi, I'm Allison Edgety, a pediatric sleep and wellness coach and a mom of two. I love to help parents find solutions. This is How Long Till Bedtime. Well, hi there, Dr. Grice. Thank you so much for joining me today. You and I have been talking about connecting for this conversation for several months now, and I'm really excited that the day is finally here. And in the intro, I told everyone a little bit about you, basically that you're a pediatrician. But before we dive in, can you please tell us a little bit about yourself?
Sure. Well, I'm originally from upstate New York near Buffalo. I spent my whole life in New York for my education, including a college in Long Island and Syracuse for medical school, and finally came down to Charlottesville, Virginia to attend residency at UVA for my pediatric residency. And I really fell in love with Charlottesville and have been here almost ever since. But I did meet my husband here. I have a stepdaughter who's going to be 12 soon. My son just turned 3 a couple days ago. Two dogs, and we just love our little home that we've created here.
You are really in the thick of it with the 3-year-old.
Oh, definitely. Yes, I've learned the new meaning of three-nager for sure.
Definitely. Well, I'm always interested in hearing what inspired people to take their career path. And so, not
Sure.
only am I interested in what inspired you to become a doctor, but I'm very interested in hearing what made you decide to become a pediatrician.
Sure. Well, I actually decided I wanted to go to medical school when I was in middle school. My friend and we felt we were good at counseling each other and our other friends with our middle school problems. So we decided we would have a business as psychiatrists. And I really stuck with that for a long time. In later high school, I was really interested in psychology. I became a psychology major for college and got my bachelor's in psychology. And at that time, I shifted a little bit more towards neurology after I worked with one of the professors at my school who was really interested in neurology based research. So I started to morph my idea of what I would do in medicine by that point and even before starting medical school. But I didn't have general pediatrics on my radar at all. I was actually pretty much against it. And that's probably going to surprise a lot of people. And I think part of it was that people thought I would be good at it, and I didn't want them to choose something for me. I always loved pediatrics, so don't get me wrong, I wanted to work with kids from the beginning. I just thought I would do pediatric neurology or pediatric something. I entertained every other specialty, even ENT, ER, surgery, you name it. Finally, I got to my pediatrics rotation and I just realized why everyone told me that I would do pediatrics is because they were right. I just felt at home. I loved the continuity of working with the kid and that family. And they came in and you knew their name and you remember them as a baby and you followed them through their life and you had that relationship, that trust. So finally, by that point, I realized I had to do what I was born to do, and that was pediatrics.
That's awesome. Well, I'm impressed that you actually became a doctor and followed your 5-year-old dream because I was gonna be a veterinarian. That did not pan out,
Yeah.
but that's
I
amazing, even though you changed path a little bit.
some days I still think I should have been a marine biologist. That was on the list back in 2nd grade, I think, but otherwise I'm happy.
Well, if my kids are following their dreams, I think they'll be rock stars. I think that was what they wanted to be at 5.
I still have that dream, actually.
That's right. So, I think about when I was giving birth, and one of the nurses had recently had a baby, and I remember asking her between contractions, "Do you think you have changed as a nurse since becoming a mom?" And I think at that point she had maybe a 10-month-old, and she said, "Absolutely. I feel like I have completely changed as a labor and delivery nurse since having my own baby." And so I'm really curious if you feel like you have changed as a pediatrician or maybe just as a doctor as a whole
Yeah.
since you have become a mom.
Absolutely, yes. I mean, there's just so much that you start to appreciate once you're going through the process yourself in terms of maybe the advice that you give or how you deliver that advice, and you can apply it to your own situation, your own experience. And so I think it does help you to maybe have a little more empathy or to really be more cognizant of everything you're asking when you're giving that family that medical plan. Whether that be for how to care for a viral illness or whether that relate to newborn care or discipline or sleep, of course, you just start to appreciate that there's so many other factors than just what the medical advice is. And if you're not taking that into consideration, then they might not be hearing your message or they might not be able to carry out those tips. So, absolutely.
That's awesome. Yeah, I think it's children change our perspective on so many things. And I think no matter what you do professionally, it can change your perspective on how you approach work or view your colleagues or view your clients or your patients. And I just think it's such a life changing experience. So I always love to hear
Yeah.
how it changes for working moms, particularly someone who works with children.
Yeah, we're always just growing with our experience, anyways. And I've learned a lot prior to having kids. I've learned a lot from other families who had children and taking what they experienced and putting that down in my notebook for when I was in those shoes. And now spreading, those tips that I've come across that worked for us as well.
Totally. Well, when you and I connected last year, I was particularly struck by your passion for helping families as they navigated breastfeeding and just feeding in general. And that's the bulk of what I'd like to chat about today. And I'm curious what made you take this special interest in the breastfeeding journey or just the
Mhm.
general feeding journey for families.
At the I think the bottom line is probably my personal experience, but I think when you look at the scene of breastfeeding, seem to be two camps, and one is breastfeeding 100% there, and the other is maybe just summarized best as fed is best, which I tend to fall into. But there's just so much that's in the middle. I think sometimes fed is best is kind of thought that formula is what you use, but there's just not one or the other. It can be both, it can be all, it can be tailored to the individual person. So that group of people that maybe don't fit into just either nursing or formula feeding feel probably have the least amount of support when you really get into it is that they don't necessarily know where to turn, they don't necessarily know all of the options, and it may not just be one or the other. It can be what you need it to be. And so that definitely applies to my personal experience in terms of not being able to really produce enough milk and pumping very early on and using formula as a supplement and doing lots of things to try to increase my own milk supply and supplement with pumped milk formula and even donor milk, and really then taking that experience and saying, hey, I know how hard it is when we tell you to pump after you just got done nursing. and we tell you to pump every time your baby feeds. Like, I don't know how you can do it that many times because I really struggled when I tried to do it that often. That group of people, it definitely became an interest to be able to reach out and say, I know how that feels and I'm here for you and let's figure this out.
Yeah, I think one thing you had said to me is that there's just no one size fits all when it comes to feeding. And you just touched on that a bit, but that it's not even one size fits all for the parent who is exclusively breastfeeding. So
Mhm.
even that journey is not going to be one size fits all. Or the same thing for a family who's exclusively bottle feeding with formula. Even that may not be one
Mhm.
size fits all. And so, can
Absolutely.
you elaborate a little bit on that concept of we need to be a little more dynamic in our support for moms, and what do you see as those common sticking points that you think are getting oversimplified when we're thinking about feeding?
Sure. Well, one of the first things to think about is the importance of birth order. It really does affect your milk supply. That first baby, for most moms, they're going to experience a longer time for the milk to come in, and it might be harder to get that volume at first, but eventually hopefully you get there, or maybe you get there. But the second baby, maybe that process happens sooner and easier. And sometimes that has negative consequences. If you were already an overproducer or you had a generous supply the first time, then you may be in a whole different camp with your second being significantly overproducing and having feeding difficulty related to that. So some of the aspects of breastfeeding get better with the second or third child. What the latch should feel like, you have that experience of how to handle the baby, how to fix the latch, but how your milk supply comes in, when it comes in, with what force, and those types of feeding issues can vary just from kid to kid. And then you have other issues as well in terms of, as you touched on with in a previous podcast, that when you were talking about your own experience with milk supply in general, where you can have low volume, or I've mentioned you can be an overproducer and you can have delayed lactogenesis, which was your experience with Addison. And so all of those things need careful attention and need a different plan depending on what the scenario is. So, yeah.
Yeah, and one thing that you had talked about when we had coffee was people not even fully understanding things like milk density, which I had not
Sure.
even really spent any time during my nursing experience thinking about that. But can you just share a little bit about what milk density means and how that could play into the feeding journey?
Sure. So, milk density, in that sense, I'm referring to the caloric density, or how many calories per ounce in the breast milk. And the average number of calories per ounce in breast milk is 20. And that number is used to create formula. For all formula, standard formula is 20 calories per ounce. But moms can vary in their see a variation in the milk density from mom to mom. So some are going to have a higher calorie per ounce breast milk, and maybe they're trying for that, or maybe that's just genetic, it comes naturally, or has to do with their diet, and their baby may gain weight more quickly than we expect as a result. And some moms may have milk that is less than 20 calories per ounce. So even though the baby's getting the right volume, we might see that they are not gaining as well as they should. And that, again, can be certainly diet related, making sure that mom's taking enough calories herself and the right balance of healthy fats and proteins. That can absolutely affect your milk density, but some of that is genetic as well.
And do you ever test milk density? Is that something that you can do, or you're judging based on how the baby is growing and
Mhm.
developing and the mom's flow and all of that jazz?
You can kind of do an eyeball test. There's some visual differences in milk that is lower density than compared to higher density, and some moms will have experienced this. Some moms may be familiar with this. are listening today. But to my knowledge, there's not really a test where we can specifically measure in just general practice what the milk density is. So the main thing that we're looking at is the infant's weight gain. And if an infant is not gaining weight the way that we expect, and I'm talking more about the 2 weeks on and not the first few days, but if the infant's not gaining weight as we would expect, we're going to want to look at what's mom's milk volume. Is the baby taking enough? Is the baby digesting that milk properly and taking the nutrients out of the milk? And if they seem to be digesting that milk appropriately and getting a good volume, then milk density might be part of it. Another sort of separate issue to that, and again, I mentioned moms who may have an oversupply, is the hind milk, because even just in the milk itself, when I say 20 calories on average, that means if you pumped a bottle and we tested the milk, then that would be the average caloric density for that bottle for the entire batch of milk, but it doesn't come out as 20 calories from beginning to end. The fore milk is generally more thin and has a lot of healthy antibodies, but it doesn't have a lot of fat and protein. That's in the hind milk. So it's really important that the infant drains one breast and gets the hind milk where all that rich fat and protein is hiding to be able to put on weight as they're supposed to. So again, if you're an overproducer, you might have a hard time getting the infant to drain you because they're just getting so full on the volume.
Yeah, it sounds like for someone like me who was not able to produce much, if anything, I think I know because I work with a lot of overproducers, but my gut reaction is like, "Oh, how what a nice problem to have." But
Yeah,
now that I've worked with so many moms who are overproducers, I realize it's not always a nice problem to have.
yeah,
It really comes with its own different set of kind of obstacles to overcome.
you're right. It really does. And sometimes I debate this with myself, is one worse than the other? I will never know, but I will never know for myself. But I think that the answer is they are equal problems. And yeah, one's not worse than the other.
Yeah.
They're both
Can we
difficult.
Totally. Like all things, nothing the grass is not always greener on that other
Yeah,
side.
absolutely.
Can we talk a little bit about mom's diet when they're breastfeeding? So you've kind of touched that the diet can play into the density of the milk and baby's
Absolutely.
weight gain and production. And so what are your thoughts on mom's diet as it relates to thinking about being successful in your breastfeeding journey?
One of the things that I touch on the most with moms is making sure that they are taking those few minutes to get healthy fats and proteins into their diet and really taking enough calories themselves. And again, being in the situation myself, I know those early days were just flying by and you would forget to eat, and or I would go to pump and I'd be just starving and I had just got the pump all set up and I couldn't really get up to go get something to eat and just really feel like, man, I wish I had a snack. So thinking about, you spend so much time thinking about the infant needs to eat and you need to pump and all the things you have to do for the baby, but you have to take care of you too, and that is number one. So getting healthy fats and proteins into your diet and getting that calorie intake up, and that might mean eating 4 or 5 times a day. It doesn't mean you have to sit down and have a whole meal, and that might not be super realistic, but finding ways to get those calories in. And that's actually one of the suggestions I'll often give families when they are trying to figure out how a friend can help is, right, text them, bring me some almonds, bring me some protein bars, cook some chicken and drop it off because I need to have this, and it's hard to go and get those things sometimes. So healthy fats and proteins. And then there are certain foods that are known as galactagogues, which are dietary supplements or dietary factors that can affect your milk supply and help you increase milk supply if your supply is low. And that is with all the other things that you might work with lactation or your primary care provider about increasing your milk supply. But galactagogues like oatmeal is one of them. Papaya is actually one of them.
Mm.
Garlic is thought to help with milk supply. All of those things can be included in your diet as well to help increase your supply if that's an area that you're needing help with.
And As I think you know, I'm a big pusher of providing support to new moms, and meals is such, I don't wanna say it's an easy way to do it, but it's such a meaningful way to do it in my opinion, because just taking that one piece off their plate of thinking, "Am I gonna get one good meal today?" and being able to
Yeah,
provide that
absolutely.
support. So, when we're thinking about the moms who are breastfeeding, do you have a meal that would be your favorite meal to take to a new mom?
I have seen several recipes online, so I'm going to defer to those experts. I am not really the best cook, but a go to for me would be just cooking up a lot of grilled chicken and dropping that off because that's easy to take, and that's something that I always find tedious. It
Totally.
doesn't seem like it should be, but it's like, oh, I'm cooking chicken again. And so I would love if somebody just cooked a bunch of chicken for me and left it at the door. I loved, you had a tip about just making a nice fresh salad. And I loved that too, because when in those early days, I'm generally somebody who would like eats fruits and vegetables and likes to have salad and kale and do those types of things. But in the early days, I couldn't even think about getting a salad together. It was just too much effort. So I love that suggestion. And leafy greens are also galactagogues, chickpeas, and almonds.
Awesome. Yeah, I'm gonna
And you
start
can find
throwing in
others.
I'm gonna throw
Yeah.
in almonds with my so I usually
Yeah.
do a chicken dish, and
Mhm.
then I do a salad with all the vegetables. I like to chop all the vegetables because I think when I was a new mom, I was definitely not gonna chop up the celery, the carrots,
No.
the onion, the radish, and so I like to put it all in there, but almonds is a good one because that's a nice, easy
Yeah.
snack that I can include, and as you were talking
Yeah.
about the chicken, I can have flashbacks to my postpartum anxiety because where my postpartum anxiety would take me is not only is it a pain to cook chicken, but I would think I'm going to get salmonella. And then when I have to hold the baby, I'm going to give the baby salmonella because that's how my postpartum anxious brain would work. So I'd be so grateful if someone else would cook my chicken for me.
Definitely. Well, I'm a bit of a germaphobe as well when it comes to cooking, so I hand wash a lot, but yeah.
Do you think that moms eating a really diverse diet or flavorful diet or incorporating spices or a really, I would say, wide range of flavors affects whether their child will be a picky eater? Because I definitely have had friends who said when they were very successful at breastfeeding, they said, I'm eating a wide range of things to try to ensure that my child's not a
Yeah.
picky eater. Do we know anything about that, if that theory is true?
So I don't think that we know right now if eating a wide variety of items and flavors in a diet while you're nursing affects if that strictly affects whether or not your child will be a picky eater. But even as early as 6 months, your child is going to be watching what you're eating. And as with 6 months, they're watching very carefully what you're eating. And so, if you're keeping up those strategies in even the early infancy or later infancy, then they absolutely will gravitate towards the foods that you're eating as well and want to try. So, there is evidence that eating a wide variety of things in your diet and different flavors and cooking using different spices and offering that to your child as they are being introduced to foods will help them not be as picky with their eating.
Yeah, and it's funny because now I've had, as you know, restricted diet for my own health reasons, and I was really intentional with my kids early on about telling them what food did for their body. So now I
Yes.
can't ever remember. I knew back then, like the blueberry is good for your eyes or whatever it was.
Yes.
So I love to educate them the benefits of eating food. And now, to your point of kids watching you, my kids watch what I eat and they'll say, "Are you sure that doesn't have gluten in it? Are you sure?" They're like, they're hyper aware of everything I eat. Like, I got this gluten-free macaroni and cheese at Multiverse Kitchen yesterday, which was delicious, and my daughter was like, "You can't eat macaroni and cheese. That has gluten in it." And I just think it's so interesting how acutely aware young kids are in watching us eat and hearing the things we say about our diets. I find it fascinating.
I think that this generation of kids is growing up in a more educated time in terms of what a healthy diet looks like. And growing up in the 80s, that was not a major focus in terms of what was put on the table. I definitely grew up in a sort of meat and potatoes environment. And to this day, my dad still says, "How did you learn to eat all those vegetables?" And I'm like, "I just learned over time. I know that it's important, so I worked on it." And so, yeah, absolutely. This generation of kids is exposed to a lot more than I know I was back in the 80s, and absolutely will have a wider variety in their diet for that reason. Definitely be more cognizant of some of the pitfalls of the
Totally. Yeah.
80s and 90s when it comes to diet, as well as what they should be doing for lifelong health. So that's an excellent way. That's an excellent direction.
Yes. I know my family still thinks I'm crazy for all the vegetables I eat. Not my kids, but my
The parents,
siblings. My
yeah,
parents
yes,
and siblings are
absolutely.
like, "You're nuts."
Yeah. Why are you bringing these Brussels sprouts to Thanksgiving? Nobody's eating them. Well, my sister and I
We
love them. So.
we just talked about my mom was here visiting, how I'd never eaten Brussels sprouts until I met my husband, and she still was cringing that she doesn't like Brussels sprouts. I was like, "Oh, they're so good when cooked well."
Yes, and there's so many places in Charlottesville where if you don't like Brussels sprouts, then go downtown and you will learn to love them.
100%. So, continuing on the topic of moms' diets, I keep having more and more clients who are
Mhm,
really needing to restrict what they eat because of breastfeeding. So,
mhm,
whether it
mhm,
be my best friend recently, her baby had blood in his stool, and she was talking to me about that journey of trying to get that cleared up and continue with her breastfeeding. And then I have a lot of parents who end up really reducing what they're eating because they suspect different food sensitivities. And
mhm.
I know, my view, which is just anecdotal, is that this is increasing and I'm hearing more and more about it from my clientele. And I'm curious if you have thoughts on why this seems to be becoming more common. Is it because we're just getting smarter and before we didn't catch it? Or is it really becoming a bigger issue for babies today versus back in the 80s, 90s,
Right,
early
absolutely.
2000s?
Well, yes, this is definitely a topic that we are talking about frequently. I feel like, yes, these days we're talking about it more frequently, probably. And the answer to your question is no, we don't know why it's increasing, or like many conditions, is it increasing because of awareness? I do know now you talk to families and you hear from grandma or you hear from mom about either parent, or and they do have stories that makes me think, yeah, one of these parents was affected or could have been affected, but maybe this condition wasn't as well recognized back when they were babies. So I do think talking about it more and being more cognizant of the possibility of milk protein allergies specifically, or food protein allergies, uh, that definitely helps with identifying cases and can seem like it's causing an increase, but is it really increasing? That one's harder to tell. But it is a topic that's near and dear to my heart because it is also a time where I find a lot of families struggling, and they don't really always know why they're struggling as much as they are, and a lot of times they actually are turning that on themselves, like, I'm worrying unnecessarily, everything's okay and it's just me, or I'm doing something wrong. And that often brings them in or brings them to me. And when we go through their history very carefully and start to point out some of the maybe digestive symptoms that they're having, and that could be related to milk protein issues, I think that it's an important turning point maybe for those families, because if the child does have a sensitivity or allergen or allergic trigger in either the mom's diet or even with their formula that's giving them a lot of digestive symptoms, it's affects the quality of life of the entire family. And like I said, they spend half the time just wondering if these are even real symptoms, or if they're just being crazy or anxious and making it more than what it really is. And so even just talking with the family about what they're seeing and giving that careful attention is an important step. But seeing if there is a trigger in the diet and figuring out a plan in regards to that, I think deserves the attention that it's getting. I really do think that.
And I, of course, never even made it this far in my
Mhm.
journey to even potentially have that problem. But I'm curious, who you view as the best person to help a mom through that process of potentially needing to eliminate food from their diet? Is it the pediatrician? Is it the lactation consultant? Is it a combination, or is it a it depends type answer?
This is generally going to fall in the realm of your general primary care provider in the pediatric office. Absolutely. Part of our training involves identifying food allergens, milk protein allergens, and other conditions that would affect digestion and growth. And so it definitely falls back to the primary care provider. I will
Okay, so
say, oh, yeah, go ahead.
I was just gonna say, so that's something you
Yeah.
definitely want to keep your primary care provider, your child's primary care provider
Oh,
informed as you head down that path.
yes, absolutely. I would encourage you to call the office and maybe ask to speak to the nurse or schedule an appointment specifically to talk about feeding concerns if you have them. Generally, outside of the well check, if that's possible. There's a lot of things that are on the agenda for a well check. And if you're mentioning in passing, oh, their stools are kind of slimy or there's a lot of mucus. Sometimes that information gets passed over, or it's just hard to really focus in on that information when there's many other things to do at that checkup. So, calling the office, talking to the schedulers, and saying, I have concerns about my baby's feeding, and I really want to spend some time talking to somebody about this problem, letting them know that you're worried, I think is the best way to get time and the attention that you need to really discuss it.
That makes a lot of sense.
Yeah.
Yeah, I find people tell me all the time they're amazed that I've done the AIP diet and I've done these own restrictive diets,
Mhm.
and it does take a lot of self-control and dedication, but I'm amazed how many moms are doing this, and they are not getting the kudos that someone like me would get for all that they restrict from their diet while they're trying to feed a human. I think it in some examples speaks to moms being superhuman and doing things above and beyond that they don't get credit for. But I'm sure when you discover that a mom is going to need to significantly restrict their diet in order to keep breastfeeding their baby, you probably have some moms who decide that they are not able to do that, or they don't want to do that, or it's just too much to take on in that time, which I could totally understand. And I'm curious how you support those moms.
Yeah, sure. I really make it a point to talk about what the options are and try to give as much education as I can in terms of what it would look like to go one path or the other, but really leave it up to the family to make that decision because I know through my experience that only the family can make that call. And this maybe relates back to, as you said, my experience being a mom. As an earlier version of myself in practice, there was when you saw blood in the stool, that was supposed to be the flag. Switch them over to a hypoallergenic formula, stop breastfeeding. That was it. And there was one mom who taught me that was not it. She was determined to continue to take different foods out of her diet until the blood resolved. And every time one food came out, he would get better, the blood would go away, and then the blood would come back. And I'd say, yeah, now it's time, it's probably time to go on this formula. And she kept at it. And I have to say, she really mostly did it on her own at that point because in my own experience, I didn't, maybe we've even just progressed in the last 5 to 6 years on milk protein allergies. And so she figured out what she needed to do and she did it. And he got better and it resolved and now he's healthy. Well, he was always healthy, but he tolerates everything in his diet. He is 6 and he's just so smart and talkative and lovely. And that experience just taught me, okay, it's not my choice about the formula or breastfeeding, and I can guide you through the diet changes if that's the direction you want to go, and I'll support you in either, and no matter what choice. If there's a certain time where you say that the diet, if you're needing to eliminate more than one food and that's too restricting, I'm going to support you in whatever choice you make. So, absolutely.
I think that was part of what drew me to you as a person when we chatted was I could tell immediately that you're a very curious person and you are not so stuck in your ways, that you're open to learning and that there could be things are changing and that there could be a
Yeah,
different way to approach
yeah.
things. So I love that example you just gave because to me that speaks to what makes you such a special doctor in that you can take a moment and think, well, I learned something here and I could potentially apply this going forward. So I love that story.
Oh, well, thanks. Yeah, I'm so thankful for them to have taught me that, and I know that one experience has absolutely helped me help others along the journey. And we do have a lot of cases going on right now, and they've been difficult journeys, but I am so thankful for the learning experiences that I've had and be able to share with those others.
I love that. So when a mom decides, all right, I'm doing this restrictive diet and I'm going to continue nursing and they're going all in, I'm curious if there are dietitians out there or nutritionists who specialize in helping these moms continue to get the nutrients that they need for themselves and for the baby. Because I know when I have gone on my restricted diets, I am having constant blood work done. I am constantly monitoring to make sure that things are doing what I want them to do. And so that's what gives me some hesitation when I hear about these restrictive diets is everyone, both the mom and the baby, getting what they need? Are there experts that you know that can help moms through that process?
There are some, but probably not enough. I'd say generally when a family is starting a milk-free diet, if a mom's starting a milk-free diet, a lot of the research or a lot of the support that you may find is mostly online about what foods they should really be looking out for. But at UVA, there's through the GI clinic, there are nutritionists that work with families for infants who have milk protein allergens or other or multi-food protein allergens, and those nutritionists can work with families both for the mom and the infant as they start to introduce foods into their diet and help guide them. But there should definitely be more of them. That would and yeah, wider
Okay.
availability. That would be great.
Well, maybe someone listening will just pursue a new
Yeah,
career path for us.
somebody step up.
They can fill that gap.
Yes.
So, you and I have talked about previously how we can respect and admire the mom who does stick it out and really goes on this restricted diet to continue the nursing journey. But that we can also respect and admire a mom who knows her limits and decides that it's not the best path forward for her family. And that both of those moms are good moms. And you had told me that I admire both sets. And I'm curious if you want to elaborate on that a little bit.
Yeah, if you're in the situation of dealing with a milk protein allergy or a dietary intolerance, you've already had to advocate for your infant at that point so much. I mean, we should, you've gone above and beyond. And there's no room for guilt. I leave the guilt at the doorstep because there's just so little time for that. And for me, as the pediatrician, and also having experience, I've been here before with other families, and I have the short term view and the long term view. I know how it's going to turn out. It's going to be okay either way. And I really just want to take that guilt and just carry it for them or just wipe it away for them because I know that they're going to be way harder on themselves than they need to be, and that it just they're doing amazing. No matter what they choose, they're doing what's right for their family. That's what I want them to do. I'll be happy if they choose what's best for their family, including what's best for themselves. That's all I'm looking for. And so, well, that might be a lot to ask for, but I don't want them to carry that guilt. They're absolutely doing what they need to do for their family, and that is number one. So, yeah, we should applaud. They should have parades.
A big decision that, I mean, definitely weighed on me heavily and still sometimes weighs on me. As you go through motherhood or parenthood, you start to realize it's almost like the first big decision of many more to come. I mean, I think about how I stressed about where to send my child to daycare, where to send them to preschool, where to, like all
Oh,
these
yeah.
big changes where the reality is there is no right answer. There's just a best answer for your family. And this is just the big one initially. And then you just get a little better, hopefully, at making some of these decisions and realizing it's a fragment of the entire bigger picture. And we're not going to get them all right all the time either, which is also something we learn along the way.
Kids are
So
forgiving. They allow you to try again. They love you, so that's the good news.
that's right. They're stuck with us. So
Well, yeah.
clearly, the whole breastfeeding journey could be challenging for some moms, and we've already talked about the different ways it could be challenging. But when a mom comes in for an appointment for their baby, and you can tell that the feeding journey is adding to their angst as a new mom, how do you like to guide them through that?
First, start by asking a lot of questions because generally that will help me analyze where something might be breaking down. We've talked a little bit about low milk volume, how that could affect baby's weight gain. We've talked a bit about how a high milk volume might affect baby's weight gain, the pattern of feeding, the quality of feeding, the quality of the latch. All of those questions are so important to really take the time to discuss and get the details. And that helps you to, as the primary care provider, figure out where there might be an issue or where something might be breaking down in terms of that process, whether it's the efficiency of the feed. Maybe the baby's gaining beautifully, but they're feeding every hour. And so if you're looking to check the boxes, great, boom, gaining weight, but the quality of life might be severely affected. And again, sleep, the big one, if they're feeding every hour. So that might be a situation where we can give a little attention to figure out what the breakdown is there. Why is the baby needing to feed every hour? So along those lines, having a low milk supply, of course, is one of the most common areas that we see just a lot of stress and strain on the family. And it can, again, when we're talking about guilt, often there's a lot of guilt there that the family might be bringing into the appointment, not having enough milk. And often these families are working uh, extremely hard to do whatever it is that they can to bring up the milk supply. And maybe in some cases, like in yours, Allison, that you do everything, you follow everything by the books to a T, and it's still not working. And I think you've expressed just the guilt that you felt, and certainly hormones and sleep deprivation and just being so exhausted have a lot to do with that guilt, but just in a sense of not knowing why is this happening and what am I doing wrong and feeling like it's all your fault. That's an area, a group of people that I think really need a lot more support, maybe than they're getting at this time. There's not a big group that specifically always knows what to do in these cases and how to help, but really being a listener and understanding that there's a lot of ways to support a family in that position when they're figuring out what to do with feeding. And this relates more to maybe those early days when you're waiting for your milk to come in and maybe it's not coming in, or it's coming in but it's still too low for what the baby would need to gain weight. And again, as a primary care provider, one of our biggest things is like we want to check the weight. And everything rides on that scale. And as a side story with my own son, I totally avoided one of those appointments because I knew he had dropped. We got him home from the hospital. I was nursing, doing the best I could. There were some latch issues, so we were doing a nipple shield. I was doing the things that I needed to do and spending a lot of time doing that. And then I realized 24 hours had gone by and he hadn't had a wet diaper at all. And so, as a pediatrician, this was like, how did I miss 24 hours? He didn't have a wet diaper. This is like against everything, all my training, and I totally missed it. And my colleague, my mentor, called to check in on me, and I'm like, I'm not bringing him because I can't look at the scale. And I still remember walking my dog and just completely sobbing, thinking about what that weigh-in would be like for me. Again, this hopefully you all don't feel that way when you take your babies into us. But for me, doing this on a day-to-day basis, I just knew what that number would mean to me as the pediatrician and what that would mean for me as the mom. And so that's when my pumping journey started and supplementing. And I knew what I needed to do at that point and that things weren't working as maybe I hoped or maybe I thought that they could. So I needed to pivot. But being in that position and also struggling to pump and struggling to increase volume despite doing all the things I just told you you could do, that journey absolutely left me more open to hearing about those journeys with other families and really making sure to take the time to say, I see you working so hard, and you may actually be working harder than the next person who comes in. And you might be working harder than the last person who comes in, and you might not walk away feeling like you have anything to show for it. If the only thing we value here is what the number says on the scale. And I want to let you know that it's really important to think about the whole picture and figure out what's going to be the best for you guys as a family.
And so I think another thing that sometimes we need to take into consideration is the well-being of the mom in general, and when that feeding journey becomes so stressful, that's also not beneficial for the baby. And I think I started to reach that point with Addison where it was taking me into to such a stress state that it was beneficial for her for me to kind of put that aside, go to bottle feeding, formula feeding, and move forward. And so I think that the angst of the mom, when that flares up and there's nothing more they can do, sometimes that guidance of it's going to be okay and we can switch to a different path is helpful.
Yeah, absolutely. And really looking at, again, looking at those individual factors. We talked about how it's not one size fits all, that the plans need to be tailored. Sometimes there's some things that you can do to maybe bridge the gap between where you are with nursing in a low supply and maybe ways to build up your supply that doesn't involve only nursing right now or only pumping, or and sometimes that involves using formula temporarily, but that doesn't always mean you're always going to need formula. So sometimes I think of it like a bridge is, and I think you said the story in another episode about Addison just being, she got that bottle and she was full and she was happy, and sometimes you really need to fill up a baby to sort of reset their energy levels. They need sleep, you need sleep, and you need to rest and recover. And so sometimes figuring out a strategy that involves, okay, let's get their belly full so that next time they try to latch, they're more alert and active and stronger feeders. So, like I said, it's not a one size fits all. Sometimes there's temporary strategies that help you get to your end goal, and sometimes you have to look at what are, have your goals maybe changed since you started the journey? Maybe things have shifted a little bit and you needed to take a step back and look at the whole picture and make a choice about which way you want to go, even though it might not be the way you thought you would.
Yeah, I haven't gotten the full story yet, but there's a conversation happening in my newborn group right now about formula and the shortage and finding formula.
Mm,
And one of the moms commented on what formula she was using, and then she just made a comment of, "But my breastfeeding journey has taken a turn, and now I've been able to go back to exclusively breastfeeding." And I just flagged it thinking, "Oh, I wanna hear more about this," because it sounded like she ended up exclusively formula feeding at one point and then is now back to exclusively breastfeeding, and I thought, "Oh, I bet there's an interesting story there," and just a perfect example that everyone's journey is gonna look different and it's not gonna be cookie cutter.
sure, yeah. Sometimes there's maybe a latch issue where you're having a lot of pain, and pain negatively inhibits your milk supply. So, some strategies might be to take a step back from actually latching and focus on pumping. And that might be a way that your milk supply starts to build up while the baby's getting their needs met in terms of calorically, and again strengthening. And then when it comes time to reintroducing them to the breast, now the milk's there and they're more motivated to do that, and they are strong, and everything just works out. Yeah, some babies are sleepy feeders early on,
Yeah.
and they're tough to deal with because they don't let you know always how hungry they might be, or no matter what you do, it's hard to get them staying active at the breast. So that's another time where, you know, reevaluating and finding a temporary plan might help you get to your long term goals if that is to nurse
Right.
exclusively.
Yeah, those babies can be tricky with sleep too.
Yeah. Yes.
So, another area that I think causes a lot of angst for parents that I work with is reflux. Can
Mhm.
you explain what reflux is? And then I'm also curious if you think it's overdiagnosed or if it falls into that category of now we just know more and we are diagnosing more babies with
Mhm.
reflux.
Interestingly, it seems that the rate of reflux is actually higher, and that actually has to do with the anatomy related to babies laying on their back to sleep. So, the way that the anatomy is situated, when the stomach is full and they are upright, gravity is going to pull that fluid down, and when they're on their back, the stomach actually sits a little bit anterior to the esophagus, which is the food pipe. So if you fill up your belly full of liquid and then you lay them down flat, some of that fluid is actually going to go back into the esophagus, and they don't have a very strong sphincter to close off that fluid. So babies do naturally reflux or regurgitate milk into the esophagus, and some of that's going to be swallowed back down. So you might actually notice your baby kind of sucking and swallowing when they're not eating anything. They're actually re swallowing their previous meal, or you might see that as spit up. So, since the Back to Sleep campaign started in the 90s, reflux is more prominent, but we generally classify this into non-pathologic reflux, which is just what I've described, where it's physiologic, it's anatomic, it's normal. The baby may spit up, but we call them happy spitters. It comes out and they're not distressed by it, they don't have pain because of it, and that gets better generally between 4 to 6 months of life when they're sitting up more and the sphincter starts to develop, that sphincter between the stomach and the esophagus. But there's another group of babies that we would classify as gastroesophageal reflux disease, or maybe having more pathologic symptoms that could include painful spitting up and reflux.
And so, is it true that to get an accurate GERD diagnosis that you'd actually have to scope them?
They would actually do a pH probe as the medical that procedure for that, or doing an endoscopy scope, which is generally almost never done in pediatrics. It's way too invasive for a day-to-day basis. So we generally do not do diagnostic tests for infants that we suspect have reflux.
And so you're going off of the symptoms and their behavior related to the symptoms.
Generally, yes. And sometimes that does involve referral to a gastroenterologist, a pediatric specialist in digestive medicine who may make the final call or may suggest certain medications. But general pediatricians and pediatric care providers are here with the general diagnosis and treatment as well of reflux. So that's a good place to start.
And so obviously some babies will benefit from taking medication to help them be more comfortable. And then there are some babies with the less severe cases or more of the happy spitters that they just spit up and maybe they're a little more fussy than the typical baby, but they don't really fall into this category where you're likely to medicate them. And I'm curious, what are some of the natural ways that you try to help those babies who are a little on the extra fussy side and
Mhm.
spit up what feels like more than the typical baby?
Well, this really goes back to the history in terms of listening to what the family has to say about what's happening. So if a parent is worried that the baby might have reflux because they spit up after every meal, but it's just maybe goes on their shirt, but they're carefree and happy and not fussy babies and otherwise feeding and growing and developing beautifully, then generally what we provide is reassurance that this is normal physiologically and there's no need to worry about the reflux being anything worse than that, and they would not need medication for that. When a family is telling us about the baby being very uncomfortable, that's when you really, again, you want to make sure you're paying attention to those details. If a baby who has reflux disease may have a lot of discomfort throughout the day that could be related to right after a feed, that could be hours later. Sometimes they're very fussy babies. Maybe these babies have also been diagnosed with colic or the family suspected colic in some way. And so what's the and to answer your question, what's the role of medication? It's been questioned for a long time in pediatrics about where medicine plays a role. What we can tell you is that the medication does not make your baby not spit up. So if you are noticing that they're spitting up a lot and are hoping that the medication is going to make that go away, that is not going to help it. What the medication would do is help with the acid in the reflux. So if they're regurgitating and refluxing and having a lot of pain related to the acid, then an acid reducing medication would help with that, but it won't stop the spit up. Now, more recently, I'd say I've largely moved away from medications completely or as much as possible because I think we are starting to see more of a link with dietary triggers again. So, circling back to that, maybe some families are willing to try a milk free diet before going to a medication. And for some of those families, at least anecdotally, that helps. It could help a lot. And so, if you're able to find a trigger that if it can be removed and the baby is happier and digestive happiness, that's the goal, then you wouldn't need those medications. But they're definitely not the cure.
If only the babies could tell us, "When you eat that, it gives me a stomach ache."
Well,
Our
they
lives
are
would be so much
trying. I guess
easier.
that's my stance. Babies talk to us right from the beginning. And speaking of how I've changed, that was one thing I noticed right away. Was just with my own experience with my son. Is just he talked to me right away, right? Like you know what they're trying to tell what they're trying to tell you right from the beginning. So yeah, I feel like sometimes I feel like pediatricians are like mechanics. You just gotta listen to what's going on. They can't tell you for themselves, but if you are keyed into those things, they try to tell us. So yeah, they do.
Right.
They do tell
With
us.
all the symptoms.
Right. Yeah.
I'm curious your thoughts on probiotics. So, they're trendy right now, and I take probiotics.
Yeah.
And I'm also seeing a lot more people post about them online for their infants and young children. And I know pediatricians often say if you're giving your child antibiotics, they might need
Hmm.
probiotics.
Hmm.
But what are your thoughts on giving infants probiotics?
Well, generally, I am a fan. I will say that, and it's not just because of the trend. It's there's actually medical data about. Well, I mentioned colic, for example. Stories of colic and all the tricks that might help colicky babies have been at least since I don't know the at least the 80s are the stories that I hear. But there had never been a known cause for colic. There had never been a known cure for colic, but in the last decade, a study came out showing that probiotics could significantly reduce colic symptoms in babies, specifically the species Lactobacillus reuteri. And so now we see products specifically containing this organism in the form of probiotics for babies. And in terms of digestive health, just widely, not specifically related to babies, but we are learning more and more about the gut microbiome that's related to all those bacteria, the good and bad bacteria that live in the gut. And babies are born without any bacteria at all in their gut. It's completely sterile. So when they are going through those first days and months and years of life, they're acquiring bacteria in their system through their environment, mostly from that's going to be from their parents initially and their family. And so I think of that yogurt commercial where it's the good versus bad bacteria. And if your baby's very gassy or spitty or colicky, then they may have more bad bacteria than good bacteria. And so doing a probiotic can really make a difference for that. Now, babies can be gassy anyways, but if they're really uncomfortable from that, then a probiotic may make a difference. And for babies who are quote unquote colicky, probiotics are a good way to turn. So, yeah.
I'm curious if you have a favorite brand that you recommend. And then I'm
Mhm.
also curious, do you think it's something that parents can just start, or do they need to work with their pediatrician on that?
Yes, you can start a probiotic on your own. You do not necessarily have to get permission from a pediatrician. And but if you do have questions, then it would be a good place to ask in terms of specific brands or specific isms that you might want to include. But there are three brands that have, again, since this study involving colic and probiotics, three brands at least have adopted these needs, and that is BioGaia and Gerber and Culturelle. They all make probiotic drops with or without vitamin D. So if you're nursing and you need to give a vitamin D supplement, which you do if you're exclusively nursing, then you can do that as a combination drop. So these three brands have made it very user friendly to get a probiotic. It's sold in most of the local stores or online, and these three products specifically contain that Lactobacillus reuteri that I mentioned, that specific organism. Right.
Dysregulates the
Yeah.
microbiome.
Well, it's not a completely benign medication. We know acids in the stomach are there for a reason. It's part of your immune system and part of your defense. And so, in general, it is something that you'd want to avoid if it's possible. There are some cases, maybe a premature infant who's going to be more prone to severe reflux where they may need to take a medication, but for the general baby with reflux, again, even the painful type, then looking at other options before going to a medication is in their best health interest. Yeah.
And just to circle back on the fact that having our babies sleep on their back is probably resulting in some of that increase, which I think is a really interesting point. But you still recommend babies sleeping on their back. We're
Oh,
better off navigating
100%.
having the reflux, but forging ahead with sleeping on their back. And it's still the safest place, even if they're a spitter.
Thank you for clarifying. 100% the answer is yes. Let's go back to the anatomy. What sits even in front of the food pipe or the esophagus is the trachea, and that's the airway. So if your baby is, let's say you have your baby on their belly and food is coming up through the food pipe or the esophagus with gravity, it's more likely to fall right into the trachea versus being on their back. And this may be one of the reasons that SIDS is reduced with sleeping on their back, is that the gravity is not going to pull that reflux right into the airway. The epiglottis would cover the airway so that when if a baby's refluxing, they're going to actually spit or vomit out the liquid, and the epiglottis will cover the airway, protecting them from aspirating. So 100% being on their back is the safest place to be sleeping. And the American Academy of Pediatrics has recently updated their guidelines there to be on a completely flat mattress. Speaking of reflux, sometimes advice might be to incline the mattress to help with that, but it is not recommended for their sleep. They should be flat on their back. If your baby is struggling with reflux, you can try keeping them upright a little bit longer before placing them down. But if they're really having a lot of painful reflux, again, talk to your medical provider about what are some of the other things that you might need to think about that could be contributing, and if this is just regular old painless reflux or something that could have an underlying cause.
Right. Thanks for
Yeah.
clarifying that.
No, thank you.
So, sleep and feeding so often come together as stress points for parents. And one of the things that I hear parents worry about is the growth curve and where their baby
Mhm.
falls on that curve or on that chart. And I can relate to that worry because I have a very petite child. Both my children are petite, but Addison was in the fifth percentile until she was about 7 years old. And I remember thinking, I need to keep feeding her during the night. I need to get her to bump up this curve because when I was a little child, I was so tall, I wasn't even on the chart. And so it just felt wrong that I had this small person. And I continued to feed her until she was nearly 2 years old. I was offering a bottle during the night, and it did not help with her sleep, nor did it help her bump up on a growth curve. So I would love for you to explain what pediatricians are looking for as it relates to the growth curve and the growth chart, and how that plays in or doesn't play in to children's readiness to sleep through the night without a feeding.
Good question. Well, generally, what we are looking for on the growth chart is consistency. And that might be tracking along a percentile, like the fifth percentile. Staying along the fifth percentile is excellent. We're looking for that kind of consistency. Sometimes they don't actually stay on that percentile, but they're forging their own path. And again, looking to see that's consistent. For my own son, again, he taught me another lesson about weight gain. Since he was fully formula fed, and we circle back to we had been talking about the calorie density in formula is consistent. It's always 20 calories per ounce. So I knew he was getting the right volume and I knew what calories he was getting. And he should have just followed along his percentiles, but he really didn't in terms of his weight. And so, yeah, a baby's activity can also affect their weight gain and where they are on the percentiles. But they have consistency. So that's what we're looking for, not if they're at the top of the curve or the bottom of the curve. A lot of times, those I started to mention physical activity as a way of expending calories. That's going to affect where you fall on the growth chart overall, or and genetics is a huge factor when it comes to where you are on the height or weight chart and where you started. If you're premature or you were post term, you may be in a higher percentile if you're post dates when the baby's born. But the theme is consistency. So you can review those growth charts with your medical provider and they can help you decide if your baby is tracking well when it comes to that. I agree with you that well, sleep and feeding go hand in hand. So a well-fed baby is going to sleep better than a baby that's not getting enough to fill their belly in those early days or later in infancy. So absolutely, they go hand in hand. And if your baby's not sleeping well or not feeding well, that probably affects the other one and can absolutely be a source of angst. In terms of overnight feeding, you point out very nicely that feeding during the night might not affect their overall growth and that it might not be necessary for their overall growth. And some infants and older kids will rely on that nighttime feeding for their daily calorie intake. Whether or not they need to take it at night is a different story. If they don't have opportunity to take it at night, they will learn and adjust and take it during the day. So for most infants, probably after the age of 4 months, that's generally the time where almost all infants would be able to sleep through the night and often sooner. But we're looking for about 12 pounds around 4 months at the latest. Most babies would be able to sleep through the night without needing to eat.
I've worked with babies who have completely reverse feeding schedules. So families will come to me with a 6 month old who only eats at night and then
Mm-hmm.
literally refuses to eat during the day. And I have so much empathy for them because that's so stressful because then you really feel like I can't drop the night feedings because they literally don't eat. We ultimately get it all sorted out and we could flip the schedule back around, and some of it is I think some babies are so good at self-regulating how much they need as far as calorie intake that if they get it all at night, then they just
Mm-hmm.
self-regulate and they don't need it
Yeah.
during the day, and I
Mm-hmm.
find those parents I can't imagine how long I would have fed during the night if Addison only ate at night, but
Well,
To your point, we can get those calories reshifted around. It just
oh,
takes a little work and
absolutely.
planning.
Yeah, well, babies, they absolutely can self regulate. Most babies don't overeat. They know when they've had enough. Now, sometimes they can get a little more volume. Again, like if you're an overproducer, it's possible they're going to take more than they can fit. And then they're going to give it back to you is that painless spit up that we talked about. But babies know when they are full and they know how to get what they need. So they are very good at self regulating their feeds. Absolutely.
Yep. So, if you could tell an expecting mom who wants to breastfeed one thing that you want her to know about breastfeeding and that whole journey before her baby arrives, what would you tell her?
I would tell her to talk to other families about their journey and both those for whom it worked out, so to speak, and for those who had to shift and make changes. I think when you start out a breastfeeding experience, you know it's going to be hard. Everybody tells you it's going to be hard, and it's just very difficult to appreciate why or how it's going to be hard until you're in those shoes. So there's really almost no way you can prepare for how difficult it's going to be. And that might be part of the reason that some of the people that you meet in the hospital are so tough on you in those early days in terms of giving you that regimen and really assuring you to keep going with the plan and it's going to work out. But talking to other families who've been through a journey that maybe didn't go the way that they thought, in terms of realizing that one, if your plan changes, it's going to be okay. And two, that it's common to have a plan that doesn't work out quite the way that you thought, or that issues with lactation are widespread and they vary. Again, overproduction, underproduction, they're both problems that you can experience and know how to maybe realize that it could be an issue so that you can get access to providers, to specialists who can help you through that problem, and just being aware that it's not for lack of trying, or that we know you're working hard no matter how it turns out, and you're making the best decision that you can for your family, no matter what you choose, which path you choose. Just encourage you to think about all the factors, not just one single factor or what social media is telling you or even what your mom or grandma is telling you. Take into consideration what your family needs. And if you make the best choice for your family, then that you should be confident with yourself and happy about your decision and not let anyone tell you otherwise.
I think it's a little bit like how I view a birth plan.
Yeah,
You can
yeah,
have a birth plan and the best intentions, but I always encourage moms that tell me about their birth plans and their first time going in. That's fantastic. I hope it works out that way, but you should
yeah.
really be open to the fact that you might have to take a different path. And I feel like breastfeeding's a little bit that way. Have your plan,
Mhm.
more power to you. I love a good plan, but then being open to the journey possibly looking different than you originally mapped it out.
That's really good. So, being a pediatrician who's worked in the hospital both during residency and later in my private practice, a lot of times we would know that if there was a very, very strict birth plan, it wasn't going to go according to the plan. We had seen enough deliveries. We knew that was not likely to be carried out exactly the way that you thought.
Stephanie, thank you so much for joining me today. Can you please tell people how they can find you?
Well, I am generally, I work 3 days a week at Piedmont Pediatrics, so that's usually the best place to find me. I do have an up and coming Instagram page. There's not a lot of content yet, but I've got a lot planned for it. Of course, we're in a busy summer with a lot of well checks, so I hope to add content soon. But you can find me at parenting underscore gracefully. That's Gricefully. And that page will provide some general tips for taking your kid to the pediatric office, how to manage some COVID issues in terms of illness and return to school and testing, and some other common pediatric issues like fever and questions that we hear a lot.
Awesome. Well, thanks again. We will link to that in the show notes. And thank you for being a champion of moms. And I look forward to seeing you again soon.
I appreciate it so much. Thank you for having me, and I can't wait to talk again. Thank you.
Thank you for listening to How Long Till Bedtime. To learn how we can work together to improve your child's sleep, please visit sleepandwellnesscoach.com.